Okay, well, let's move into the diet as a whole because there's a lot of nuance in what we just got into that I want to dig further into. But I think it's important we set the template here before we get into that nuance. And you mentioned ketogenic diet before. So we already know seed oils are out and we want to watch our refined carbs and eliminate those. Let's talk about this ketogenic diet and how we structure that.
Yeah, so there are many ways to do a ketogenic diet. Not all of them are very healthy. Some of them are much healthier than others, just like any dietary pattern. There are good and bad ways to do it, less healthy and more healthy ways to do it. So, well, first let's define a ketogenic diet. So a ketogenic diet is any way of eating that lowers insulin levels enough to turn on fat burning and generate clinically meaningful levels of ketones in the blood. And most experts would say that that process begins metabolically meaningful or clinically meaningful levels of ketones in the blood begin at about 0.5 millimole of beta hydroxybutyrate, using a blood ketone meter to measure that. And then, higher than that may be better for, depending on the circumstances. So, but that's where the process begins. And so, the ketones are very important. It can be very important, particularly if you have a condition in which you have lost some of your ability to process glucose properly. So if you have insulin resistance, then you have lost some of your ability to process glucose properly. And if you have certain types of psychiatric conditions, these include certain forms of autism, bipolar disorder, schizophrenia, and early dementia. There are many mental health conditions where the ability to process glucose, so to extract glucose, energy from glucose, is impaired in some way. And so, if that's the case, a ketogenic diet that generates ketones that can circulate in your bloodstream and cross into the brain to bridge that energy gap, that ability is a godsend because you need that supplemental energy source. And that if you're able to bridge that energy gap with ketones early enough in your life, you might be able to prevent some of those cells that have been sputtering and kind of trying to just get by. You might be able to sort of bring them back online and help them to thrive again. And that experience of sort of waking up the brain with ketones is a really common experience that patients have. That when they switch to a ketogenic diet, especially if they've had things like memory problems or brain fog, depression, they suddenly feel like, and there are many different phrases that have been used for this. The lights have come back on, or they've woken up from a long winter's nap, or suddenly, their brain they see clearly again. They have mental clarity, right? So this experience seems to be related to energy production. So a ketogenic diet is really, there are a couple of other ways you can get into ketosis and make ketones. One is fasting, and another is calorie restriction. So even if you're eating a very high carbohydrate diet, if it's very low in calories, say 750 calories per day or less, you will go into ketosis. So there are different ways. And if you exercise very vigorously, you will start to enter ketosis as well. You'll start to burn fat and get into ketosis. So there are many different ways to get into ketosis, but the only way to stay in ketosis all the time without fasting long term, which ultimately becomes dangerous, or restricting calories long term, which also ultimately becomes dangerous, or exercising around the clock, which isn't possible, is with a ketogenic diet. And the way to get into ketosis with a diet is by lowering your carbohydrate down to usually less than 50 grams per day, often 20 grams per day or so, and replacing those carbohydrate calories, which are normally the majority of the calories in our diet, replacing those calories with fat and keeping protein adequate. It doesn't need to be a very high excess protein diet. In fact, it's better if it isn't. Protein to meet your needs, fat to meet your energy requirements, and carbohydrates as low as you need to go to get your insulin levels down and turn on fat burning. So ketogenic diets are really unique in this ability to energize the brain and body differently than other types of diets do.
What I love about this keto template is the fact that it's addressing everything we've talked about to this point. You're going to bring insulin down. You're going to bring down oxidative stress. If you're eating the right oils, inflammation too will come down. If you're eating the right oils, you're going to have those eliminated as part of what we've talked about. And then the other piece, so it's stopping destruction, and then it's providing this additional energy source. So it's a win-win all around.
It really is. One of the benefits of intermittent fasting is you enter this low insulin state, and that allows different pathways to switch on than when you're processing food. So when you're processing food, there lots of your burning and building pathways are very, very active. You're taking those molecules in and you're using them. So it's almost as though you've got your foot on the gas pedal, and if you imagine your cell being a factory, and all of these assembly lines and furnaces are being stimulated by the incoming fuel, right? When you stop eating, that can quiet down to a certain extent. And you can do some maintenance work in your factory. You can kind of clean things up. You can do some recycling. You can take out some trash, and you can repair some of the damage that's happened to your machinery during that high glucose period of time. So when your food, if you're eating in a way, and this is how unfortunately many people do now, if you're eating almost all the time, every 2 or 3 hours, your body never gets a chance. Your insulin levels never get a chance to come down low enough to let that switch take place. That it's called the glucose to ketone switch, where you're burning less glucose and more ketones. And when that switch gets flipped, all of these healing and repairing and resting and recovering pathways and recycling pathways are allowed to turn on. So you really want to spend, I believe, this is based on my reading of the science, that all of us should be spending some time in ketosis on a regular basis. It doesn't mean, for optimal health, it doesn't mean that everybody has to be in ketosis all the time. For some of us, we do. Some of us do need to be in ketosis all the time because we've lost so much of our ability to process glucose effectively and in a way that isn't going to be damaging for us. But if you still have a reasonably healthy metabolism, even if you don't have any mental health problems yet, even if you're healthy in every other way you can measure, you still want to protect that metabolic switch for life. And so I believe that it's important to go into ketosis on a regular basis. And I think this is the benefit of not snacking between meals, making sure that you're not eating overnight, that you're taking a nice long break between dinner and breakfast, ideally maybe even waiting till lunch. Really give your delicate insulin signaling system and all of those building and burning pathways that are usually in high gear right after you've eaten, give them a rest. And that allows your natural healing processes to help you recover from whatever damage might have been going on during that food processing period of time.
For somebody that's tuning in right now and they're metabolically unhealthy, say they're suffering from a mental health challenge too, but they're excited about the hope we're providing here and the information, how do you recommend they transition into this keto template? Because if they're metabolically broken and they're a sugar burner right now, insulin resistant, how do they do this in a way that is going to be, we want them to stay on this long term. We want them to have a good experience and do it over a period of time that facilitates a good transition. And then the other layer I'll add to that is testing for ketones early on, something you recommend during that transition at least.
Yeah. So I recommend in the book a gradual transition for a lot of reasons. We'll come back to that. But what you're really doing with a ketogenic diet is you're lowering your insulin levels, right? So a ketogenic diet's any way of eating that lowers insulin levels enough to turn fat burning on and generate ketones, right? So you have to design the diet in a way that's going to lower your insulin levels, and I show you how to do that in the book, and we've already kind of talked about it a little bit. As your insulin levels come down, fat burning turns on, and ketones start to rise in the blood. So now you're in ketosis, right? So this, but you're not there yet. You're not home free yet, because you've generated ketones and you can see them on your meter. There are different ways of measuring ketones. There's a blood meter, there's a breath meter, there are urine strips. The blood meter is the most accurate way of measuring what your ketone levels are in your blood in real time. The other measures aren't as accurate, but they're still so much better than not measuring at all. At least in the beginning, it's really helpful to know how you need to eat to keep your ketone levels in what is considered by many of us to be a therapeutic, potentially therapeutic range, right? So zero point 0.5 millimole for a lot of people isn't going to be high enough, and because to bridge that energy gap. So in a lot of cases, we see that people need to have their blood ketone levels. The ketone level that's measured by the blood meter is called beta hydroxybutyrate. The beta hydroxybutyrate level, you want to be at least 1.0 millimole. And in some cases, you might need it to be higher, 1.5 or even 2. But somewhere between 1 and 3 for most people is going to be a reasonable place to start and experiment with. You can then fine tune it from there based on what you notice in terms of your mental health progress. As you monitor those ketones, you might notice, oh, I feel my best when I'm at, say, 1.2 or higher, right? Or you might say, oh, when I go above 3, I don't feel very good. I need to make sure I'm not going too high, because ketones can be too high. So you're going to be learning about your metabolism as you measure and go along. So coming back to, okay, you've got ketones showing up on your meter. That's a wonderful thing. That's only step one, because it takes cells a decent length of time to switch gears and be able to use ketones and fatty acids. The rest of the body uses a lot of fatty acids as well as some ketones to be able to burn those molecules efficiently for energy. So this transition can take, 2, 3, 4, 6 weeks. And really optimal fat adaptations, called fat adaptation, burning fat efficiently for energy, optimally for energy. The optimal fat adaptation can take months, but most of that adaptation takes place within the first 2 to 6 weeks. So getting through that period is most of what my work with patients is about. Because as you're transitioning to a ketogenic diet, your brain and body are they're seeking their new equilibrium. Things have been disrupted. You're saying, okay, we're going to do things differently now. It's as though let's say you own a factory that's been making Volkswagens for 20 years, and now you've got a new foreman coming in and say, oh, we're going to make Mercedes now. That doesn't happen overnight. Lots of different parts. You need to order new parts. You need to change the pathways and the systems inside your factory. You need to train the workers. Everything needs to shift gears in order for you to be able to make that new car. Same is true with burning ketones and fatty acids for energy. If you've lost a lot of your metabolic flexibility, which many of us now have, you won't be able to switch comfortably, quickly, and easily between fat and carbohydrate as your energy source. Children do this beautifully. Adults, not so well. So you want to give yourself that time. And when you're transitioning, that process of seeking your new equilibrium can be uncomfortable. It can be physically uncomfortable. It can be psychologically uncomfortable. And so that's where some professional support really comes in. And that's why I train clinicians how to do this, to help people with mental health concerns transition safely to a ketogenic diet, because the medications need to be managed very carefully. Mental health needs to be managed carefully. Physical health conditions need to be managed carefully during that transition period. And then once you get to the other side, and this can be, for some people, as little as 3 days, for some people more like 3 weeks, for others it may be as long as 3 or 4 months, usually not longer than that. You will usually, in most cases, experience what I really I think this is the right phrase for this, a different state of mind. You've fundamentally changed your brain's operating system. And for most people, it feels very different to be running on more ketones and less glucose than it does to be trying to run on mostly or all glucose almost all the time. It's a very different feeling.
Would it be fair to say, in a general sense, somebody that's going to take this on themselves, somebody who is, we'll use the example, mentally healthy at this point, not on medications, but wants to be preventative, is the whole idea just to slowly lower the carbs then? Because you mentioned it's such a difference in the transition depending on the person. Is it just really a feel thing? And then if you have a meter that's measuring ketones, factoring that in as well? Or just in a really general sense? Because again, it's hard. There's a lot of nuance to all of this, but I'm assuming it's just slowly bringing the carbs down and letting your body adjust.
Slower is better and it's safer. I mean, there's some people can switch easily in and out of ketosis, like I said, but that's not the majority of us. And when you add medicines and other health issues into the mix, it just becomes much more complicated. So what I've done in the book, just because safety first, right? There's no need to plunge yourself overnight into ketosis. There's no emergency going on. And if there is, diet is not your answer right now. You need to stabilize that emergency situation first. So what I've done in the book is I've asked people to lower their carbohydrate intake to about 90 grams a day for a couple of weeks first. For reference purposes, for comparison, the standard sort of typical American diet contains between, say, 225 and 325 grams of carbohydrate per day. So you're lowering it by, say, about 2/3 or so, depending on what you're eating now. And what that does is that allows your insulin levels to come down more gradually. Because if you drop your insulin like a stone by, say, prolonged fasting or very strict ketogenic diet, and you're trying to get really high ketones on your meter in a matter of 2 or 3 days, you can do that. You will generate ketones pretty quickly if you do that in most cases, but that's not necessarily what you want to do. Because when your insulin levels drop too quickly from too great a height, especially if you're eating a very high insulin diet, that's going to be a huge, completely unnecessary shock to your brain and your body. Because high insulin, when your insulin levels are very high, insulin tells your body, for example, to hold on to excess fluid and excess water and salt. And when you drop your insulin levels from a great height dramatically, your fluid and you're going to lose a lot of water and you're going to lose a lot of sodium through your kidneys very quickly. Now, you want to, these are healthy changes. You want to lose that fluid retention, of course, that's a good thing. You don't want to be holding on to too much sodium. These are healthy changes. But when you do this too quickly, it can be dangerous. Your blood pressure can drop, especially if you're taking a blood pressure lowering medication. Your blood sugar can drop, and especially if you're taking a blood sugar lowering medication. So these are really, really, these can be, if you're not approaching this properly, life-threatening changes to this. Ketogenic diets are powerful biochemical metabolic interventions. Now you want that. You want the power of that diet, but you want to be smart about how you approach it. And so this is not a dangerous diet, but in combination with certain health conditions and certain medications, the transition can be dangerous. And that's why you need good professional support. The other issue is the psychiatric medications themselves, because as you're transitioning to a ketogenic diet, those medications will require some monitoring. The levels of certain medications can change, the blood levels, and also the side effects of those medications. You can start to sometimes feel more sensitive to certain medications, and that's where really a skilled psychiatrist who has a lot of skill with managing medications and helping you adjust the doses is just really very important.
How do you feel about somebody using exogenous ketones or an MCT oil during that transition phase? Obviously, we still need to adjust our own metabolism. And then beyond, are they something that you see as being helpful tools for people that are already in ketosis on a regular basis? So both aspects there.
Yeah, so exogenous ketones, they're a tool, okay? And they're a tool we didn't have available to us all that long ago, but we do have them now, and people are very interested in them. Lots of people are making lots of money on these supplements, but for good reason. I mean, they can be useful. And so I tend, well, let me say this. When you're first transitioning to a ketogenic diet, which is what we were just talking about, you can see this drop in energy. You can see people feeling really tired, unfocused, even depressed. They're not able yet to make full use of the ketones and fatty acids that they're asking their cells to burn. So they can run sometimes low on energy. And what can be helpful sometimes in these situations is support your ketone levels, support that brain and body energy with exogenous ketone supplements. So these can be either MCT oil is one option. MCT oil, these are just shorter fats. So it takes less time to chop them into even smaller ketones. So they turn rapidly into ketones in the body. So they can raise your ketone levels a little bit, sometimes enough to make a noticeable difference. And then the next level up is ketone salts. These are actual beta hydroxybutyrate molecules attached to salt molecules, usually sodium and or calcium. And these can raise your ketone levels even a little bit more. And then there are ketone esters and pure beta hydroxybutyrate supplements. These are the most expensive, but they're also the most effective at raising ketone levels in the blood. And so all of these can be useful as you're transitioning. If you're having trouble transitioning, they may be worth trying. But there are a couple of problems with them. So one is they're expensive. Another is that they only last, an hour or two in the body. So if you're going to be really counting on them, you need to take them multiple times per day. And you can't take them overnight, right, while you're sleeping. So they have their limitations. They're also highly processed ingredients. So they're not natural. We're not naturally exposed to these fats and these salts. So we don't really know, if there's any risk involved there. But, you want to, again, I'm a food first psychiatrist. So I really like you, ideally, especially once you've transitioned onto the diet and hopefully you don't need that kind of extra support anymore. Ideally, what you want is not just more ketones in the blood. You want your glucose and insulin levels to be nice and low, because your high glucose and insulin levels are what's driving a lot of the metabolic mayhem in the first place, and driving a lot of these processes like the inflammation and the oxidative stress and the insulin resistance that underlie so many of these mental health disorders, right? So if you're just taking a supplement, you won't get the benefit of lowering your insulin and glucose levels down to where they need to be. Only on a ketogenic diet can you make your own ketones from inside your own body smoothly, reliably, 24/7 around the clock for free and lower your glucose and insulin levels on top of that, because you can't be in ketosis if your glucose and insulin levels are high, unless something is terribly wrong. So you want all three of those things. You want low insulin, low glucose, and a reasonable sort of reasonably therapeutic range of ketones themselves. That's what will bring you optimal metabolic results from your ketogenic diet. But I also use supplements sometimes to help people get back on a ketogenic diet quickly when when their diet's been interrupted, let's say by a holiday or life or whatever happens, or a decision to take a day off, to get people, have them support their higher ketone levels the very next day, while their bodies are trying to burn off that extra carbohydrate that they splurged on. So you can use them as tools. And in some cases, longer term, people who aren't able to change their diet or can't, for whatever reason, say cognitive impairment, change their diet, then these become really important tools. But for most of us, I try not to use them too much.
Coming back to our analogy there of the Volkswagen factory transitioning to a Mercedes, as we're talking about these hacks for ketosis, it gets me thinking about our body and our metabolism. Somebody who is a sugar burner hacking that with these, say the MCT oil or the exogenous ketones, I wonder how differently those work in the body for somebody that hasn't changed their metabolism.
Such a good question. One of the questions I love thinking about, and I don't have an answer for you, but I will tell you what it is the question I like thinking about is, our metabolism is designed in this yin-yang fashion, right? So when insulin is high, ketones are low. When insulin is low, ketones are high. So it's completely unnatural to have both high insulin and high ketones at the same time. So when you're eating a standard diet, your insulin levels will be high. And then you take an exogenous ketone supplement. Now you've got insulin and ketones together. I'm not really sure whether there are any negatives to that, but there might be. And it's interesting to think about, right? But I can tell you that you will not get the full benefits of ketosis simply with supplements alone, because in order to really turn on those healing and recycling pathways and all those maintenance pathways, you have to have low insulin levels. And so ketones alone are not going to do that. They'll help you with energy production, but they're not going to help you shift gears. They're not going to help you go from that sort of ramped up state of food processing down to the quiet, healing, recycling, repairing mode that you want to switch into on a regular basis.
Have you ever seen with somebody that's new to this and they haven't adapted their metabolism over time, using again one of these hacks to get the feeling of what it'll be like when they do go through that transition and start making their own ketones? So somebody right now who's depressed or has high anxiety, using, say, an MCT oil to hack that in the meantime, and this ties to what we were just talking about, the fact, can our machinery even use them properly if it hasn't adapted? So a lot of layers to this, but I'm wondering if you've seen anybody feel the mental effects of what we're getting at with making the dietary change in the short term by hacking it.
Yeah, so I've had patients do this, and there are case reports in the literature of people benefiting from strategies like this. Some of the people who have come to me for help have tried this before, and some of them who come to me for help ask if they can try it when they start working with me. I've seen some people do this, but what I can tell you is it's really hit or miss. So some people will say, "Oh, I do feel better. My mood is a little better. I feel steadier. My better mental clarity. It doesn't last long, but they perceive benefits, cognitive benefits primarily, and sometimes mood benefits. But it's really been hit or miss, and so some people take them and they feel absolutely no different at all. And I can only imagine that the reason for that may be that the whatever the mechanism is, whatever the underlying problem is that's created their particular mental health disorder, isn't being addressed by ketones alone. So it could be that the insulin levels are still too high. It could be that the glucose levels are still too high. It could be that their mental health issue has absolutely nothing to do with ketones or glucose or insulin, because that's certainly a possibility as well. But people can certainly try that. But what I don't want people to think is that, oh, if I try that and it doesn't work for me, that means a ketogenic diet isn't worth trying, because that's absolutely not true. A ketogenic diet has many more benefits than ketone supplements alone. So if you've tried it and it hasn't helped you, don't give up. That does not mean that a ketogenic diet couldn't help you.
How often do you see it working with patients when they do the ketogenic diet and they do it, quote unquote, the right way, transitioning into it? And then how long does it take? And again, we have to account for that transition phase. But somebody who's feeling like they're going to give this a try and their diet is very classical and standard right now. So 2 layers to that question. One being, how often does it work for people, at least to some extent?
Mm-hmm.
And then 2, how long does it take?
So let's see. How often does it work? I've consulted with hundreds of patients over the past 10 years, and in the early part of my practice, I wasn't doing as much work with ketogenic diets as I was as I gradually been using these more and more. And really, in the past 6-7 years, the ketogenic diet's been the cornerstone of my practice, but I use many different strategies in my practice. So I would say, out of all of those people, I can count on less than 2 hands the number of people who have not experienced noticeable, meaningful degree of benefit to their mental health. I can't say that about any medication, not by a long shot. Most medications do not work. they can be helpful, and they certainly help some people. And for some people, they are really critical part of their treatment plan. But most people do not benefit very much from medication, whereas most people do benefit from changing their diet in the right ways. And it makes sense that that would be true, because when you're changing your diet, you have access to mechanisms that no medication can reproduce. You can get benefits that aren't possible with medication. These are root cause approaches. These go directly to the root cause disturbances that we see across the board in neuropsychiatric conditions: the inflammation, the oxidative stress, the insulin resistance, lots of other factors as well that we could talk about. But those are the three, the three of the major ones. And so most people do benefit. Not everybody can come all the way off their medications. Some people can't even reduce the dosages or the number of the medications they're taking, although many people can. There are some people who never need to start medications in the first place because they've used these strategies. So lots of potential benefits. But even if you don't want to stop your medications because they've been so helpful to you, or even if you're not able to reduce the dosage or number of medications you're taking using a ketogenic diet, the ketogenic diet is almost always still worth continuing, because people feel so much better and they become so much healthier, metabolically healthier, on the ketogenic diet, even if they're continuing medications. The ketogenic diet is really the only intervention natural, non-medication related intervention I'm aware of that can fight the tremendous metabolic disturbances that we see from some of the stronger antipsychotic, stronger psychiatric medications, such as antipsychotics and certain mood stabilizers. So a combination of one of those medications, which can have metabolic side effects such as weight gain, high blood sugar levels, high insulin levels, high triglycerides, heart disease, type 2 diabetes. Those medications are well known for causing a lot of those issues at much higher rates. If you combine those medications with the ketogenic diet, you may not be able to come off of all of your medication in every case, but you will feel a lot better on that medication. And it really will give you a lot of benefits metabolically. So that's question one, is how many people benefit? Most people benefit to some meaningful extent, and some people are able to come completely off medication or eliminate the need for medication. So now the question is, how long does it take? There are some people who respond in 3 days, some people who respond in 2 or 3 weeks, and some people who need to wait more like 6 months. 6 weeks to 3 months. So I usually say 3 days, 3 weeks, 3 months these are the kinds of the most common timeframes that I see. Almost everybody, in my experience, obtains some noticeable benefit from the diet after 3 weeks. So there's something about that 3-week mark which seems to be a turning point metabolically for a lot of people. But in the book, I do recommend that if you haven't seen a lot of improvement by week 3, don't give up yet. Keep going, because there in some cases you may need to follow the diet for longer for that shift to take place.
Earlier, when we talked about hacking our metabolism and bringing MCT oil or exogenous ketones in, you said that could be helpful for somebody if they fall off the diet. Gets me thinking about how rigid somebody needs to be on this diet as they're transitioning, as they're using it in a therapeutic way. And then long term, after they've healed their metabolism, can they get more lax, do you find, with because the ketogenic diet is obviously a strict diet and it can be hard, especially in social situations. Can we take our foot off the gas, a couple years down the line if we've been following this strictly?
A couple of things to say about that. So one is it depends on who you are. There are some people who can be a lot more flexible with their diet, even once they've fully fat adapted, even if they've been on the diet for a year or two. Yes, some people they notice they get a little bit more leeway with their diet than they had in the very beginning. And that suggests that a certain amount of healing has taken place and a certain amount of adaptation has taken place. So there's a little bit more wiggle room there. Often there's not a lot, but sometimes there is some. There are very few people that I've worked with who have been able to go on a ketogenic diet. And I work with adults only. I'm not a child psychiatrist. There are very few people that I've personally worked with who have gotten benefit from a ketogenic diet, stayed on the diet for reasonable length of time, say 6 months, a year, year and a half, 2 years, and then been able to stop the diet and maintain those benefits. In most of my patients, their symptoms do come back often rather quickly when the diet gets interrupted. And that's that can be a good reality check for people to say, oh, I guess I really do need to eat this way. So it's good information, useful information. But we see in children with epilepsy who start a ketogenic diet, and there's decades of clinical and research experience in children with epilepsy and ketogenic diets. It's very interesting. Children can, in many cases, they can stay on the diet for a year or two for severe epilepsy, multiple seizures per day, and come off the diet after a year or two and remain seizure-free, eating a regular diet. And that really strongly indicates that the diet has allowed a tremendous amount of healing to take place. Children are much more metabolically flexible. Seizure disorders, epilepsy is a very different kettle of fish than a lot of the mental health disorders we see. But I think that in the case of adults who have been, most of us, feeding our brain improperly our entire lives and with lots of metabolic damage, I think many of us are not as metabolically flexible. And so, but I will say that in my patients who have better physical metabolic health, meaning my patients, especially my patients who exercise regularly and have good muscle composition in their body, good strength and muscle composition, they tend to do better. They tend to be more metabolically flexible than people who are only using diet as their pillar of better metabolic health. So the people that I have noticed have more leeway in their diet are the ones who are also paying attention to their physical fitness.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
If you've got PTSD, ADHD, OCD, eating disorders, early dementia, whatever the issue is, I will try to help you. My definition of a brain healthy diet is it has to nourish the brain, protect the brain, energize the brain. You can see dramatic improvement.